Good afternoon, everyone. Sarah Barker with Connect Our Elders, and today is another Empowering Aging podcast. I feel very fortunate to have with me today Tina Buchanan, the CEO of Visionary Care Consultants, a concierge care management firm in San Diego, California. Tina is also the co-founder of Vets for Elders, a local nonprofit organization that fills in the gaps and resources to our lower income elders throughout San Diego County. Now, before I turn this over to Tina to have her share with you about her background and why she's doing the work that she's doing, I want to make sure that we thank our sponsor for the Empowering Aging podcast, Retirement Genius, which is all things alternative funding solutions to pay for care. So huge thanks to Retirement Genius for sponsoring the Empowering Aging podcast. Tina, thank you so much for being my guest today. And I would love for you to share with our audience who you are.
Well, thank you so much for having me, Sarah. I'm very excited to be back here. It's been a while. I love the podcast that you do. I think it's so important to talk about how to get ahead of things here and educate the community. That's what it's all about. So I love it. And thank you. So a little bit about me. I am the founder of Visionary Care Consultants in San Diego, California, as Sarah mentioned. Sarah and I met probably 4 years ago. And we had a vision of putting a nonprofit together. And so that was our second endeavor together. So I'm super excited that I met Sarah and we have become great colleagues. So thank you for having me here.
My pleasure. So what is this initiative that you are spearheading for Vets for Elders?
Thank you for asking about our holiday initiative. Every year since 2018, Vets for Elders has done a holiday event. I believe in giving back not only throughout the year, but I know that this time of year especially, some of our elders in the community who are more disadvantaged economically are not able to make ends meet. Last year and a couple other years prior, we've done an Adopt an Elder event. This year, we are adopting a whole community of elders in Chula Vista. There is a whole community with 83 residents that we are going to be supporting with essential items such as socks, hygiene items, blankets, also kitchen supplies. Many of these elders can buy food. They have access to low-income food programs, but they have no way to cook. They have no way to clean. So essentials such as, dish soap, laundry soap, things that will help them do laundry, stay in their apartment. That's what we're looking for. I'm really excited that we have a couple of sponsors who have donated a meal for these 83 residents and their caregivers. So I'm really, really excited about that. We're going to surprise them with a holiday meal and some good music and some gifts and essentials. So that's our drive this year.
That's wonderful. And where are the drop-off locations?
So we have 2 drop-off locations. We have one at Right at Home Senior Care in El Cajon. And then the second location right now is at Otay Ranch, Ivy Park, and they have a bin set up there in their lobby. It's an assisted living in Chula Vista, so you can drop off donations there. My team is also helping pick up donations, so we can come to you. I know tomorrow I'm meeting one of my partners and we're going to have lunch and she's going to give me some donations. So reach out to me directly if you're not able to come to one of those drop-off spots, and we can certainly get some items from you.
Fantastic. And we like to go ahead and make sure that we acknowledge the sponsors. I know huge thanks to Visionary Care Consultants for sponsoring, and I believe that there are some other sponsors as well.
There are. So we have Right at Home care. They do non-medical home care in El Cajon. We've also teamed up with the NPRA San Diego chapter. So they are sponsored this year. They're doing a lot of behind the scenes work to make it happen. We have Sunshine Placement, Jean Vaccaro. She's helping with the meal, Visionary Care, and then of course, Vets for Elders.
Fantastic. Well, great job on spearheading this, Tina. You definitely have a heart for our elders. And I think everybody in the San Diego community knows that. And if you don't know Tina yet, I highly recommend that you connect with her, learn more about her, learn more about visionary care consultants, and learn more about Vets for Elders. So without further ado, Tina, let's move into the educational portion of today's Empowering Aging podcast. You will be educating on the 5 red flags to look for during the holiday season.
Thank you for having me, and especially this time of year, because this is the time of year when families, especially this year, are getting back together, many for the first time. Some families got back together last year, but this is really the first year that we've been out of the so-called pandemic, and things are starting to normalize as far as our routines with our families. And so some things I'm going to be talking today about, some of the things you can look for if you haven't seen your loved one in a while, or even if you have, maybe you talk to them regularly, or you see them daily, but because you see them, you're not used to really looking at things in depth. So I'm just going to be going over some of the 5 things that you can be looking for, and we'll talk about what to do about those things if you see them come up. So the 5 things go into 2 basic categories. So the first category we're going to talk about is physical changes, and changes in daily patterns of the way maybe your mom or dad is doing something. So the first one is changes in mobility. A lot of people may have been super mobile a couple of years ago, and they've been at home, older individuals, especially isolated, not going out into the community. Maybe the only people they have in their life come into them, and they don't get out much. And so you really want to look at changes in their mobility. And what that means is, do they have difficulty walking? Are they using items to hold on to in the home? Maybe they can get up and walk around, but you notice they're holding on to walls, or they're holding on to the furniture more than they used to. It could also be seeming unbalanced, right? Maybe they're mobile, but they have difficulty. They're either shuffling their feet, and they are, seeming unbalanced, or they're having difficulty getting in and out of a chair, in and out of a car. So there's different ways you can look for changes in mobility. It's really
Did you
just
mention if you notice them hanging onto furniture more? Is that like as they're getting around the home?
Yeah, hanging on to furniture more, they'll hold on to walls, holding on to people. These are most of the time our older loved ones are very independent, and they don't want to ask for help. So they may not say, "Hey, come over here and help me get up." Just observe how they are doing throughout the day with their mobility. Many people are deconditioned from a couple years of not getting out and not having that movement or that exercise. So deconditioning can happen really fast, and it could look completely obvious, or these things could be very, very subtle, that are not so noticeable to the eye, maybe at one time of the day. And maybe it's that they're okay in the morning, but you notice as the day goes on, they're getting more fatigued. So really look at the daily pattern of it too.
Okay.
Because that's important. Someone may be doing really well in the morning, and 2 hours in, they're just tired, right?
That's what I was wondering about, like if they try to mask it, because we know from the industry, they don't want to seem as though, right, they're as weak or easily fatigued, or that they need help. So what I hear you saying is that watch it the whole day, because they may seem stronger in the morning as if they're completely independent, and we may not notice it because sure, they might hang on to the back of the couch. I think we all do that from time to time, right? But if you start noticing that it's a consistent holding onto the wall, holding onto furniture to get around, is that what's indicating that there's a problem?
It could be, right? It could be an indicator. And the reason I'm choosing the 5 red flags that I AM is they can all go together, or it could be one, it could be two of them. So not necessarily just this one thing could be a problem, but there's other things you can be looking for too that will let you go, okay, that makes more sense.
Okay. Okay. So that's the first one. I'm sorry. And you're moving into the second one?
Well, and part of the first one too is really like looking at their daily routine, right? So their mobility and their daily routine. So has there been a change? Are they just sitting in their chair all day and they used to be completely mobile? Are they now staying in bed all day? So what is the activity level that's going with the mobility, right?
Mm-hmm.
Because the activity level can also tell us if there's changes in mobility. Not outward on the surface, it may not look like that, but that could be an indicator that there's a mobility issue as well. So looking at the mobility from actually how are they walking, how are they doing their ADLs, but also what do the daily routines look like? Are they very different than they used to be?
Okay. That's great insight.
Thank you. So number 2 is really another physical change, and it goes with changes in weight in their daily weights that you've seen them at for time. So this could look like they've gained a lot of weight. It could look like they've lost a lot of weight. And what is the reason for this? If you're in the home and you've noticed this, you haven't seen them in 2 years, look at, are they eating? What are they eating? What is their nutrition like? It could be that they're not eating the right foods for them. If they're diabetic and they're eating certain kinds of foods, that could lead to weight gain. Also, their drinking patterns. Are they drinking enough fluids throughout the day? This is really important because dehydration can be prevalent and can cause a lot of further issues. And the first thing that we see a lot of times is like people's eating patterns may be normal, but you haven't seen them drink one thing throughout the whole day. So really observing that. We're going to talk a little bit later about what to do about these things and how to intervene, but really just observe like how much water intake are they getting, and how much and what kind of foods are they eating. So that's the second one that's very important. The next 3 are really more environmental. They're under the category of environmental. So this is my favorite part of talking about this because I see it so often, is looking at changes in their environment. They can tell us so much that without even having to say a word. Um, and my favorite part of this is medications.
Mm-hmm.
So we have a lot of people who um, it may seem like they're doing okay on the surface, but if we look at their medications, it can tell us a lot about what's going on with the person, not only medically, but cognitively, um, behaviorally. And the reason being is that sometimes there's way more medications in the home than there's supposed to be. There's unopened prescriptions, there's expired prescriptions. There's all sorts of things that could lead to polypharmacy. Are there multiple pharmacies listed on these bottles with multiple doctors? It's a good thing to look at the medications and ask questions about that. Just because they say they're taking their medications and you see 10 bottles over there, you really want to know what they're taking them for. And does it look like they're taking them regularly? Or some of them, pick them up, shake them, don't open them and spill them out, but shake them. Do they all have the same amount in them? Are they taking more or less than they're supposed to be? So medications can tell us a lot. And it could be because they are confused and forgetful and they're not taking their medications. It could be that they have multiple doctors that are giving them these medications. And which could lead to further problems if those providers aren't speaking to each other or the pharmacies aren't speaking to each other. So medications can really tell us a lot about what's going on in the home with an individual.
That's a great point. And oftentimes if certain medications, as you mentioned, maybe something got lost in translation from if they're going to the doctor's appointments themselves, and maybe there's some forgetting of, okay, now you have to stop taking this medication. We're giving you this now, but then they keep taking both, which I've seen.
Right.
We do have a question. Do you want me to hold it to the end?
No, let's go ahead and answer questions as they come up. I would love to.
Okay, so my friend Mike Nally, holidays are very emotional times for the elderly separated from loved ones. How would your team encourage clients discouraged or feeling loneliness?
I think that part of this is really having an understanding from the family, and that's why this is so important. And thank you for your question, Mike. As a professional, our team can come in and do an assessment and really help them to get out of the house, to do certain activities. We have specialists we can bring in that can do activities with them in the home. But I think this topic is really important because what we may see when we go in to evaluate someone, the family may have a different perspective of what's been going on, because they've been watching this throughout the years of taking care of their parents or their aging loved one. Even if it's a neighbor, right? People that are coming in and out of the house are going to see things and be able to give us that timeline of when did this change take place. To really help us determine, to your question, Mike, is how do we encourage them? Because every person's reason for feeling lonely or being discouraged is going to be different. And so we really have to have a clear picture of what maybe is happening behind the scenes, or was there a triggering moment where this occurred, in order to know how to intervene to be successful, because it's not a one size fits all for everyone.
A customized care plan. And I know if you want to speak a little bit about the thoughtful engagement program that Visionary Care has.
Yeah, I would love to. So our program is called Thoughtful Engagement, and we partner with a great care manager out of Arizona who created this program during the pandemic for this reason, for individuals who have been socially isolated. They are lonely, and our program really tailors our approach individually. We really go in and assess what are the factors to this, and who did this person used to be, because that's what they've lost in their life, is really that sense of independence. And everybody used to either have a job or wear a certain hat in their family. We have a story of a lady who, her whole life, she was the mother of cards, of every holiday card you could imagine. And she loved just sending holiday cards and birthday cards and things like that to her children, grandchildren, great grandchildren. And when she lost that, through our conversation and assessment, and we were able to recreate that for her by coming up with a list of family members to reach out to, by making cards with her and sending them off. We just saw that she completely lit up, and you could see like she felt fulfilled and like she was back again, right? This is my purpose. I've missed this. So we really tailor it to what's going on and who the person is at their core.
I love that.
I hope that's a helpful answer for you.
I think it probably was. And maybe we need to do another Empowering Aging podcast on just that topic. So we have another comment that I want to make sure that we read to, Tina. So Michelle out of Texas, Clear Path Home Care, says she loves this education. This is why, as a home care agency, we see a spike in inquiry, because so much can change in a year or a few months. The holidays are a huge evaluation opportunity. Absolutely.
Yeah.
So great segue back into the 5 red flags to look for.
So the next one, going back to the environment, is looking at, is there stacks of mail piled up in the house? This one is Very important for numerous reasons. It can really tell you a person's cognition. Again, it can tell you their physical limitations. But the things you want to look for is there lots of unopened mail that's just sitting on the counter piled up? Are there shut off notices that you're noticing when you're helping going through the mail? Maybe they're not paying their bills. This is again going to give you a lot of information. Are you seeing multiple bills for magazines, subscriptions, QVC, maybe even some scam type things in the mail? The holidays are the biggest time for our older adults to be scammed. And now they're very tricky. They make it look so great. And so you can notice by looking through the mail, like what kind of things are they purchasing? Whose attention are they getting? Right. Because this can lead to further problems. It could be an indicator of depression. Maybe they are reaching out to buy all of these things, or they have these subscriptions to things because they're lonely. Maybe they're doing this because they're getting scammed and they don't remember. Maybe they think they're supporting a really good cause. We have a lot of older adults who have always grown up. I have numerous clients who they're used to giving donations to churches and Salvation Army and all of these great things. And so when they see anything that looks like it, right, their brain is going, oh, okay, I love that cause. I want to support it. So really looking at the mail and going through and checking for those shut off notices, checking to see if they're scams, and asking, how they're doing paying with the bills. So these things you can observe through looking, but also observation can be done through asking questions. So don't be afraid to ask questions about it. So that's the fourth one. And the fifth one is changes in cleanliness to the home. And this could vary because we have some people who may have been they stayed at home, they were the homemaker, they're used to having their home look a certain way. You could have someone else whose idea of cleanliness is different. So it's not a judgment, right? Think of your particular loved one and what their pattern was in their life growing up and how has it changed. This could also look like, are the animals in the home fed and walked? So we have a lot of clients who have animals and maybe their house remains the same. They've hired a housekeeper maybe to come in and do some of those things they haven't been able to do. But their animals maybe look a little bit malnutritioned, or they're having trouble with the litter box. They're not walking them. Those are indicators. What is the smell of the home? And the reason this is really important is this can tell you if there's a physical change that you're not seeing. So a lot of times, if you're smelling urine in the home, your loved one may be having episodes of incontinence and not know how to change themselves or not want to ask for help because that is a very private issue. And so episodes of incontinence can lead to cleanliness issues on the person and also in the home. So look for any sort of smells like that. Sometimes, it could just be the trash is piled up, again, causing an odor in the home. Now, it's not necessarily the problem isn't the trash per se, right? But what's the limiter? Why aren't they taking out the trash if they used to do that every day? It's an indicator of a bigger problem.
Tina, I like that you're saying it's not a judgment and that is a symptom of the problem. Because personally in my family, right, with a loved one, a grandparent, I remember the adult children becoming like almost too critical, right? Yeah. About why isn't this happening? Why aren't you doing this? And not looking at it like, okay, well, why isn't she doing this anymore? So I think that that's really valuable insight to anybody listening right now.
Yeah. And the other thing I would say to that, Sarah, is again, going back to asking questions. I would always start the conversation with your loved one by asking more open-ended questions that can lead to a discussion instead of the why, right? Because why can seem judgmental and they may not know the why. So asking clarifying questions, maybe when was the last time you took out the trash, mom? Do you need some help with that? You know what I mean? To get more clues. But I thank you for saying that, because if you come from a place of judgment or a place of telling them what to do or a place of misunderstanding, they may not open up to you about what's really going on.
And of course, I always advocate for bringing in a professional care manager, perhaps, because if it's very uncomfortable for an adult child, or you just know, right, that you don't know how to have the conversation, or you already feel anxious that it's going to go sideways with your aging loved one, don't ever be afraid to engage a professional care manager, Aging Life, right, care manager, to come in and either have that conversation directly with your aging loved one, or you can be a part of it depending on the situation, right? Because you guys know how to approach these topics.
We do. And I think one of the main questions we get asked all the time, which we'll kind of talk about a little bit more too, is when the person is resistant to the conversation, what does that look like? And when you work with a professional, there's ways that we can help facilitate those conversations in a way that is more meaningful. Like I said, coming from less judgment. We have no attachment to the outcome necessarily in the beginning, right? When we're just assessing, we're a neutral party. Sometimes these family members have they have a whole lifetime of stuff. Baggage, could be issues to work out, could just be patterns of playing things out and stories and roles within the household that we don't have. And so we come from a fresh perspective because we don't have those things for years and years that have, led to maybe barriers with mom and dad. So we can just be open-minded and have a conversation.
So was that the fifth one that we talked about, or do we have one more to go over?
Yeah, that's the fifth one. So I'll go over them just really quickly again. So changes in mobility and daily patterns, right? Changes in weight and eating, drinking patterns, environmental, such as medications, stacks of mail, and cleanliness in the home. So those were the 5 things that I really wanted to talk about today.
Those were very insightful. So now, in regards to those 5 things, do you have any recommendations on how an adult child, a friend, a neighbor, right, if they notice any of these 5 red flags, how can they approach the conversation? You mentioned open-ended questions and coming at it from a non-judgmental place.
Yeah, really asking questions. I'm going to say that again because it's really important. And also just sitting down and having a conversation if you're able to. Maybe you're not the person in the family that should be having that in-depth conversation. So maybe you notice these things, but you know that because of your pattern or the roles that you and your mom, say, for instance, have played throughout your life, you need to bring in your brother, right? Maybe not as a full-on intervention where you're having 5 people sitting around, but, maybe mention it to your brother. Hey, I've noticed these things with mom. I know you're really close with her. Can you talk to her about these things? Because every dynamic is going to be different. So asking questions, offering to support them without giving them a feeling of they don't have a choice. So older adults, it's really important that they maintain their level of independence. And the reason that they don't ask for support a lot of the times is they're worried that someone's going to come in and take over, right? So really just finding out from them how you can help, or offering them, hey, has this been a struggle for you? If so, here's some ways I can help. Offering them, a clue of where you might be able to help without inserting yourself and saying, I'm going to come in and take over everything. I think most people are really, really scared of that. And that's why they don't ask for help.
So a couple of questions, Tina. If somebody wants to learn more about visionary care consultants, whether it be your care management services or the thoughtful engagement program, how can they learn more about VCC and get in touch with you?
Definitely. So you can go directly to our website, www.visionarycareconsultants.com. It's a really good place to start because we have frequently asked questions on the website. We have testimonials. We have our different service offerings. I think it's a really good starting point because care management is not a subject that you can call in and say, what is care management? It's a very complex and even thoughtful engagement, right? We're not an activity program. That's not what it is. So really go to our website and look at the offerings that we have. The frequently asked questions is really, really helpful because our services are not covered by insurance most of the time, unless you have a long-term care policy. They are private pay model. But there's a lot of questions on the website about what makes working with a care manager or a thoughtful engagement specialist. Why would we pay somebody to do that when we could go through the government or use our insurance to do so? So it's a really good place to start. You can also reach out to us by phone. We have intake specialists that can give you a free call, get you in touch with a care manager or a TEP specialist. We call her thoughtful engagement specialist, and really get you connected with them one-on-one to decide if this is something that you need or something that you would find valuable.
So since we brought up that care management is, private pay, why don't we, since we still have some time right now, share about how care management is a proactive service, and in some cases it ends up saving the family money because of the work that you guys do. So would you like to touch on that?
Yeah, definitely. So we've had lots of people ask that question, right? Why doesn't insurance cover this? Which I can't answer, right? Everybody should pay for something like this. However, the difference is when you have a neutral party that you're paying for, we're not tied to a bigger system. We're not tied to the outcome of the insurance or our boss. We are the bosses of the client and the family, right? So whatever their goal is our goal, essentially. We don't have a governmental body telling us what we can and can't do. And so I think a lot of families need a level of support that those programs in the government, which some of them are great, they are, but they can't provide the level of service that a care management company can. We're talking about hand-holding through a lot of different things. Our caseloads are very small. A full-time care manager on our staff may have 10 to 12 clients, maybe 15 at any point. And some of those aren't active all the time. So we really have the time to help walk families through the process. And a lot of the bigger systems, they just don't have the time. They have caseloads of 80 to 200 people. That's not what you need when you're navigating an experience that is so overwhelming and so costly. So going back to the cost, we hear from family members who are flying all over the country to come in and check on mom and dad every single month, and they're losing time off work. And they're having to pay extra daycare to help do these things that we can help do for them. And so on the surface, you are paying for a service, but the value you get is really that emotional support, and we save people money. We find ways. If it's not the family flying in, right? We're saving them money on insurance. We're saving them by an extra hospitalization, which they're going to get a big bill for. We have ways of finding them veterans benefits that can help pay for some of these things. So the possibilities are endless, and our healthcare system is very expensive. So
and let's not discount the value of peace of mind and consistent communication with what's going on, and having that designated advocate for your loved one. But with that said, maybe for any adult daughters or adult sons out there that may think, oh, well, then what am I going to do? Please, let's reiterate for them. A care manager is not taking the daughter's place or the son's place. If anything, if you want, you can think of a care manager as an extension of you to handle the things that you don't know how to do and probably don't really want to be doing.
Yeah. It's a combination of things. We have some families who they want to do it all still, which is fine. And we're just there to support them on the back end saying, hey, these are the questions to ask. Ask for a referral to this type of doctor. We have some that say, you do it all. Like, I just want to be, and I think everybody wants this. They just want to be the son or daughter again. And so they don't want that daily rigmarole of having to make all the phone calls and be at every appointment. And they want us to fill out all the paperwork. So we work very differently with every family. So again, it's not a one size fits all. We have some where we're just consulting on the back end, and really being their support system. And then we have some where we're doing everything, and going to every appointment. And there's some that are in between, right? Where they do some and we do some, and we work together as a team.
It's customized to the situation.
It's definitely customized.
So, I mean, we've touched on some of the things that a care manager does, but again, since we have some time, why don't we share with the audience what does a care manager do? I mean, so much, but
yeah. So what I can tell you is I'll give you an example of like some of these red flags we just talked about, right? How we would come in and intervene with that. And I also want to talk about, if it's okay, the risks associated with not addressing some of these things that we talked about, because they go hand in hand. And when you know the risks, you're better educated to have a conversation with your loved one about either allowing them to help or bringing in a professional. That's what's really important, is not that they're having to change mobility, but what is the risk and how do we solve the problem? So let's talk about some of those risks, if that's okay, Sarah.
Absolutely, please.
Yeah. So, when we look at physical changes of a loved one, what could really be going on in these subtle things is some of the biggest indicators to physical changes, and even these environmental changes that we mentioned. The risks are tremendous. We're talking about people who mostly live at home with little or no support. They may have a caregiver a few hours a day, or they may have a loved one living with them, but most people don't have someone with them 24 hours a day at this point when they get to us, or when they get to like a home care. They have to get to that point. And what usually leads people to get help is these main things. Multiple falls in the home that are causing multiple hospitalizations or further problems. Multiple medication errors that are again leading to maybe a hospital stay or a change in behavior. Those things are really important. Some of the risks are depression, anxiety, further isolation, because if we don't address it, they go deeper and deeper and deeper into the depression or whatever's going on. Cognitive decline. The less we're mobile and the less we are healthy with our diet and we don't do our daily activities of living, and we're not keeping up with those things that we used to be doing, that can really lead to cognitive decline.
Mhm.
That maybe there was a factor there already. Maybe you have a family history, maybe you don't, but changes in mobility and changes in how often you socialize can really have an effect on our cognition, which can lead to further problems.
Mhm.
Some of the other risks are dehydration, right? And dehydration can lead to hospitalizations. Some other risks, chronic UTIs can occur if
Mhm.
we're not taking our medications properly, we're not eating healthy, we're not drinking, we're dehydrated. Um, and UTIs can look like dementia. They can look like Alzheimer's. They can look like things that are truly medical. And so really getting ahead of those things, but also being aware that, some things that are going on medically can really affect the behavior of your loved one, of the
Mm.
older adult.
Mhm.
And most of these lead to hospitalizations. And then as far as like the environmental factors and the mail and maybe they're not taking out the trash as much as they used to. Those kind of things are indicators that there could be a problem with cognition. And when we look at problems with cognition at whatever level, or even depression or anxiety, there's a much more increase of likelihood of financial abuse and exploitation on many parts. It could
Mm.
be a scam in the mail, like we talked about. But it could be that they're hiring a company who's not vetted or someone they found on Craigslist to come in and take out their trash, right? What else is that person being exposed to, or how can they exploit them? Not necessarily saying they would, but they could, right?
It happens,
It
and it
happens
happens
a
more
lot.
frequently than what we want to realize. Yes.
Yes, it does. And it could just be they thought they were doing a good thing by, finding someone to take out their trash, but they're not vetting these people. They're
Mhm.
not realizing that they are fragile and that they can be taken advantage of. It's a
Mhm.
much different way than it used to be. My dad always tells me this story about how, he lived at the beach growing up and he lived 2 miles from the beach and he could walk to the beach with his surfboard and he could, hitchhike, and everybody was so friendly. And he always felt safe and his parents always felt safe. And, the times are really different. And the one thing I will say about, financial abuse and exploitation, or even getting in the car with like a stranger, if you're an older adult, is coming out of the pandemic, there's a lot of people who haven't worked for many years. They need a job or they're finding other ways of exploitation because they're struggling too. And so we're just seeing an uprise in a lot of scams and things like that around that,
Mhm.
because of the hard times that we're all having as a collective.
Mhm.
So, take the pandemic on top of our elders who were already at risk for multiple financial abuse scams, and that's just, being exacerbated. So,
Mhm.
those are some of the risks really that are associated with not taking these observations that you may be seeing and and not doing anything with it.
Right. You have to have the conversation, is what I hear you saying.
Conversation. Yeah.
No matter how uncomfortable it's going to be, have the conversation.
Hmm.
Absolutely.
Yeah. And
Yeah. If anybody ever wants to book you to do some training, perhaps on this topic or any other topics, because I know that you are very knowledgeable in a lot of areas, but maybe some home care company would love to stream you live in to provide some training for their staff or any sort of speaking events. How can they reach out to you to inquire about doing so?
Thanks for asking that, Sarah. I know you have a lot of professionals that watch our podcast. I think you're going live on LinkedIn. And so
Mhm.
sometimes these things may seem like they pertain just to older individuals, but this topic and other topics that we can talk about, they pertain to all sorts of healthcare industries, senior professionals. Hi, Michelle. I would love to anytime. I love education. I'm like you. We have to get in front of it. And the more people know about it, and the more our own companies know about it internally, and how we can collaborate as professionals in order to get people the help that they need. It's really important. I know a lot of attorneys, and there's a lot of social workers, case managers. There's all sorts of groups that need CEUs. So I love educating about topics, and I have numerous that I can do. This one just really pertained to today and the holidays, but definitely reach out to me. My email is tina@visionarycaresd. The SD stands for San Diego. .com, and I would love to come on a podcast, come talk to your team, do a lunch and learn. We're really about education in the community, and we have some brilliant topics to talk about.
And I know firsthand, Tina and her team, they know what they're talking about, and also just so many examples how you have stepped into these situations that were totally chaotic, as high of a crisis level as you can get, and then just worked your magic. So I know firsthand about those situations. You guys are amazing at what you guys do.
Oh, thank you so much, Sarah.
So you're welcome. Before we wrap up, again, big thanks to our sponsor for the Empowering Aging podcast, Retirement Genius, all things alternative funding solutions to pay for care. Tina, please remind everybody about the Vets for Elders holiday drive.
Yes, so we are collecting essential items for our deserving elders here in Chula Vista, trying to raise enough donations to serve 83 residents. And again, we are looking for essentials, hygiene supplies, socks, blankets, anything that can help them with cooking or cleaning, laundry. We're also looking for an additional sponsor to take on the dessert for the meal. So if you are out there and you want to be a sponsor to host the dessert for our deserving elders, just reach out to me again on my website or through my email. And we're taking donations now. Today's December 5th through the 16th. So we have a little bit under 2 weeks. So, and we're going to be delivering them on December 22nd. We have a community who is going to put their activity for their residents in their assisted living is they're going to put the gift bags together. So we're really excited that they can take that opportunity to also give back to their peers as well. So reach out to me if you have any questions. There's those 2 donation spots, or you can contact me and I will, or a member of my team will meet you and pick up those items.
Fantastic. You can sign Connector Elders up for the dessert sponsorship.
Oh, thank you, Sarah.
I didn't know that was available. Yeah, so we'll communicate offline about that. Tina, thank you so much for all that you do for elders in San Diego, the people you've helped in Tennessee, and your leadership of Vets for Elders. You are amazing, and thank you so much for being my guest today.
Thank you.
So,
well, happy holidays, everyone. Thanks for watching. Please reach out with any questions, and we'll connect soon, Sarah.
This sounds great.
Bye-bye, everyone.